All right, good morning, everyone. It is 9:02 on December 7th, the last day of Medicare open enrollment, and life goes back to normal? I don't think so. We got a lot to do. So first and foremost, I want to say congratulations to our top producer of the month for our December 1st effectives. Mr. Victor Cromedy is our top producer for Medicare. Last month, just wanted to give a shout out to him. He did a great job. I know some of you were pushing to get those 12 ones in just to clear out the rest of the year. And 12 ones are a great time to write business because you get paid and then you get paid again on your residuals right away in January. So I hope a lot of you took advantage of that. Looks like you guys did. So moving on, we've got our training calendar. A light week this week. Today at 9 o'clock here, Bright Health is doing their individual training for their ACA products. So you can jump on our training calendar and get registered for that as soon as the call ends. You can jump on that. That's at 9 o'clock today. Later today at 11 o'clock, we've got Devoted. They're doing their coffee and chat sessions. That's at 11 a.m. And again, that's for all markets, but that one's specifically hosted by Jeanette in the Orlando market. You can join in any market and get your questions answered about Devoted. And then the only other training I see on the calendar this week is on Thursday, the 10th, and that looks like at 11:30, Devoted is doing another coffee and chat session. This time it's hosted by the Jacksonville manager, but again, all markets welcome because they're going to talk a lot about the global offerings that Devoted has for your members. And we're going to talk a little bit about a Devoted experience that was brought to my attention last week later in the call. So that's the training. Just please make sure you've got that training calendar on your laptop, iPhone, iPad, Stone tablet, whatever you're using to chisel in that training in your week. Just make sure you've got it. If you need help loading that training calendar, please let us know. We'll be happy to help you out. Okay, so it is the last day of Medicare open enrollment, so I know many of you are busy closing the rest of your sales. As a reminder, you do have 24 to 48 hours to submit paper applications depending on the carrier. However, I am recommending that you get these applications in by the end of the day. If you cannot at least get them in by the 24-hour mark, I would not recommend waiting 48 hours to turn in any application right now. It looks like CMS is really coming down hard on these plans for processing. So all the applications you finished today, if you've got e-apps, you don't have to worry about processing. Congratulations, you're done. You can go home and put your feet up. But those of you that are doing paper applications, you've got a lot of work. You're going to be burning the midnight oil, processing those applications. We're here to help, but just make sure that you get those processed today if possible, but no later than tomorrow for January 1st effective. Those folks that don't have an SEP, AEP ends at midnight tonight. So please make sure you do that. If you're already wrapped up or you wrap up early today, best practice, check on the status of all your applications. Make a list of all those apps and go through them, call each carrier, and check the status of those apps. Now, some carriers, you can go onto the portal and you can see where they are in the process, if they've been accepted, if they've been declined, if they're pending. So you can do that, or you can call broker support directly, and they'll be glad to look up the status of each one of your apps. Last week, Humana sent you a template, so you can download that template and fill out any questions that you have on any of your applications. You can load up your entire list on that template and send it over to broker support, and they'll be glad to check on those apps, and they'll reply back with your template already pre-filled. So that's a pretty cool little thing that Humana's doing. But don't waste any time checking on your apps. The last thing that you want is to show up in January and your member thinks that they're on a plan and they're not. And I have witnessed this, and it's not a good thing. So check those apps, make sure that they've all been processed and approved, and so you can get business taken care of. I do want to point out we've got some new features that we've been working on. And kudos to Tom and John for working on the Gold Key. They did an exceptional job, slimming down what all that information in a simple, easy-to-use format. And so now, if you haven't been in the Gold Key in the last couple of days, jump back in there. They made it so easy. I was extremely impressed with how easy it is now. So thank you guys for doing that. There's plan comparison guides in there for agent use, of course, but everything's organized, very simple, summary of benefits and links there. I couldn't get lost if I tried. So very much appreciated to both Tom and John for working on that. And I know they've got even more improvements that are coming down the pipe there that they have some ideas for to make it easier and simpler to use on that Gold Key. So we're excited to see that roll out, so thank you. Another couple announcements for people that we're working with here. We have a partnership with Access Community, and Dr. Rafael Lopez has been coming to our office on Tuesdays and Wednesdays to help the community apply for Medicaid applications, okay? He also does food stamps, cash assistance, and other community services that relate to the DCF. He is an official DCF partner. Now, they are not agents. They do not have a license. I made sure of that. They are not an agency, health insurance agency. They are simply a community partner for the DCF, and we've partnered with them to come in to assist you and your clients with helping apply for Medicaid or renew their Medicaid food stamps, cash assistance programs, okay? Now, why did we do this? Well, we've heard stories that you all were sending your clients over to the health plan to do the Medicaid application, and then somehow, some way they meet a captive agent at that company and they get switched. So we wanted to help you prevent that from ever happening. So Dr. Lopez is now in our office Tuesdays and Wednesdays, and we're going to be sharing his information at the end of the call. So you can send your clients to him, and he'd be happy to do the Medicaid food stamp cash assistance programs with your members. He can do it over the phone or via email if your client has those capabilities, absolutely. But he is physically at the office Tuesdays and Wednesdays at our West Colonial office. So you can send your members over there to get that Medicaid application taken care of, or you can connect with him on a phone call or whatnot. So Dr. Lopez is going to be there tomorrow, starting tomorrow. So you can always call our 844 number to get a hold of him on Tuesdays and Wednesdays, and then we'll be sharing his number at the end of this call so you can get a hold of him directly if you prefer. So that is how we're going to be helping people with Medicaid. He does not do LIS applications, so I just want to mention that. That is a separate application, but I am going to be asking if he can help in the future on that, so that would be a great help if that's possible. Moving on, so we have a big announcement. We have a new team member that has joined our team, and I'm going to see, oh, he's on the call, so that's good. I'm going to unmute him here. We have added a new team member, Mr. Nick Street, and some of you may know him from his previous role at WellMed, and he is, his job is going to be to help us grow doctor referrals. So, Nick, can you help? Can you hear me?
I can. Can you guys hear me?
Yes, sir. There you are. So,
right.
So absolutely. So, Nick, can you kind of talk about your new role here at Health Plan Markets?
Absolutely, absolutely. So thank you guys. Again, my name's Nick Street. Some of you do know me. Sorry, I was trying to figure out this Microsoft.
He's a new guy on town. Yeah.
I'm the new guy, so anyways, I'm used to using the WebEx and stuff. So, anyways, we'll get it figured out. So, anyways, I'm the director for physician relationships, and I'll send everybody my contact info as soon as I figure out down there at the chat box, and that way you guys have my email, but also my cell phone number. I'm excited to be here and working with you guys. And like we said, a little bit about me and a little bit about my history is I've been in outside sales for over 17 years, and I've done everything from, yellow page advertisement sales to pharmaceuticals, to home health, to most recently what some of you guys have worked with me is with WellMed and Optum. So I was the director for growth and broker relations there, and my job there was to build the relationships with the brokers. And I've done that, but also to handle some of the issues that come about, which I know several of you have called, and we've worked through those issues and so forth through the years. And then also to train the agents like yourselves and the brokers, on the value props of the different Optum and WellMed offices. So that's when Justin and Sergio and myself started talking, and basically there was an opportunity here, and I was able to join, with Health Plan Markets. And my goal here, and just so everybody knows on the phone, I do not have a insurance license, so I can't enroll anybody. So that's where I'm going to need to work with you guys as the agents and brokers to help enroll some of these members that I help identify. So my job here more specifically is to get you guys more enrollments. I'm going to help you build, some of those relationships and take them to the next level. I know that everybody's busy, and it might be something that I can help jump in and take that relationship to the next level with you, maybe for a time issue or just the ability, whatnot, but also helping with, the accounts that we do have, and identifying new practices out there. And also identifying where providers, because I did work on the ops side too at WellMed, identifying where some of these providers can potentially make more money by switching some of their members. Well, again, I'm not an agent, so that's where you guys will come in, and I'll help walk the doctor through how they could profit more, benefit the patient more, and also benefit yourselves more by switching some of these patients over to a different plan or network that makes a little bit more sense for them. So I'm excited to be here. I'm excited to meet some of the ones that I haven't met before, and really get out there and get in the field and work with you guys on, how I can help you with more enrollments.
Couldn't have said it better myself, buddy. Awesome. So I learned something about Nick on Friday, that he was a business owner at one point, and and I was happy to hear that, because each one of our agents technically is their own business. So Nick knows the struggle that you go through on a daily basis, growing and managing your business, because he's been there too. So I thought that was a cool little thing that you shared with me. Thanks, Nick.
Yep. Thank you, guys.
You got it. So again, for Nick, this week we're going to be training him and brainwashing him and all that good stuff for HPM. So be easy on him. But what I would love to do this week, if you have time, because I know things may slow down for you, may not, but when you get a chance to have a conversation with Nick, and Nick will probably reach out to some of our key agents and agency partners, but we'd love to hear what you think Nick's role could help you. What parts of Nick's role could help you, and is it finding doctors? Is it building on the relationship you currently have? Is it making inroads where you couldn't make inroads, or maybe it's training? How do these doctors work, and how are they making money, and how can I, self-generate leads on my own? So there's different avenues that Nick is going to focus on that, unfortunately, in the past we haven't been able to bring a lot of attention to. So, and we understand that right now COVID is changing our landscape, and the doctors may not, invite us in as much as they used to. So Nick is going to do his best to create and manage those relationships, both remotely and in person when possible, for these physicians to help maintain that relationship for you and help generate leads. Because that's, I know at the end of the day, guys, we don't eat unless, we make a sale. We get it, right? But we want to do the right thing for the right reason. So Nick is going to be identifying with the physician specific patients that need insurance that may be on the wrong plan because they're just not being served properly. Or maybe there's an opportunity for the member to get better benefits. So that's the first step. And then the second step, as Nick mentioned, is profitability for the physician. And then third is us. Where do we come in? Well, we're the one, you as the agent are the ones that actually are manifesting that sale. So really, really, really excited to have Nick part of the team. Fits us very well. And I'm happy to know that many of you already have a great working relationship. So very, very excited for that. Just be easy on him until he gets in the saddle. So all right. So I've got some plan news. So with the plans right now, Cigna has announced that they are now you can go in and take CE credits through the Cigna portal. So I thought this was really cool for you guys to know. So if you guys are in need to renew your CE credits with the state for your licenses, depending on where you are, you could need as much as 40 credits to complete to keep your license active. And with the state, so Cigna has a way for you to go into the portal and get CE credits. For more information on that, check your email. It came from Cigna last week, and you have the ability to go in there into the portal and get some CE credits. So I thought that was really cool. Also from Cigna, just as a reminder, they do have a telephonic enrollment assistance line that you can call with your member to enroll them. Now, I'm talking a lot about Cigna. Why? Well, they're a 5-star plan. So that means you guys can enroll them tomorrow, December 8th, for January 1st effective, and for the rest of the year because they are a 5-star plan. So it would be in your best interest to ensure that you know how to use Cigna to get enrollments, that you know how to do these enrollments over the telephone remotely. And so they sent out an email last week, and I believe their phone number for the telephonic broker enrollment assistant line has changed. So that new number, or this may be a reminder to you, that number is 866-619-9293, and that was sent to you from Cigna last week. Again, that's 866-619-9293. So you can call with your member on the phone, do a telephonic remote enrollment. They do everything for you. They fill out the application in their system, and you get full credit for that enrollment. So just wanted to remind you that that's out there. And again, more information, Cigna's got information in the email that they sent to you last week. Or you have Ron Landires, who's our broker manager for us at HPM. You can reach out to him for either the CE credits or that broker telephonic enrollment tool. All right, let's talk a little bit about marketing. We've got these Facebook ads that seems like everyone's doing these days. Aetna has created new Facebook ads, and they've launched those. Those are now in your marketing portal, so you can jump in there and download those new Facebook ads for Aetna. You can customize them with your phone number and your name so they can contact you directly. So you can get those created, and those live right in your Aetna portal. So got another tool that you can use in your tool belt there for your marketing. We also have United Healthcare, which just created a Safely Connect letter, and this is basically their advertisement for both their members and non-members about how they can enroll with you remotely. So just a nice little marketing message that was created by United Healthcare that's already pre-approved and templated. So you just go into your Jarvis portal there and drop down into the marketing section, and you can look under letters, and you'll find the Safely Connect letter. And again, just announcing your ability to do remote applications in case those that are in need of your help are not willing to go out into the world. We get it. We understand. So there's just a way of letting people know that you are able and capable of doing remote enrollments. I would definitely say if you haven't sent out anything to your members during AEP, I get it, but now is a great time as things start to slow down to pick up those client referrals. How do we do it? We send them a thank you note. We send them a Christmas card. We send them a happy holidays, New Year's card, whatever you decide to do for the holidays. It's a great opportunity to reconnect with your members, and this is just one of those ways, you know, letting people know with that letter. Because remember, every touch is a reminder for your client that you're out there doing what you do, and it's a reminder to send them referrals, send you referrals that they have for you. So keep that in mind as you're building your plan for the rest of the year, because you got a lot going on and there's still a lot of competition. I hate to see agents wrap it up and see you next year. There's so much to do, and there's so many people that still need help out there, especially with all the inroads that we're creating to help generate leads and enrollments and to meet new people for you. A quick update from Humana. Humana's Vantage upload application tool will be shut down, closed, turned off on December 11th. So you've got a couple more days to use that upload tool. Just as a reminder, if you do a paper application, you can go into your Humana Vantage portal and upload your paper application directly. So there's no need to fax it, no need to mail it. You can just upload it right into your Vantage. It's a pretty cool feature, but they are shutting it down on December 11th. I don't know if they're bringing it back or working on it or what's going on, but they sent an announcement last week. So if you are using that paper app upload tool for Vantage, it will be turned off on December 11th. So just mark your calendar and make sure. And it's at 5 p.m. They're going to shut it down Eastern Standard Time on December 11th. So just remember, don't upload anything after that date and time. All right, so let's talk about situations out there. I've had a couple of interesting situations that popped up last week that I thought I should mention on the call. You'll notice when you pick up those D-SNP plans, some of them have a premium on them, okay? And as a reminder, that premium is there not by accident, it's by design. The premium on the D-SNP plans that you pick up might be, you know, $14, $21 and change, or whatever, really weird number for a premium. What that is actually the premium for the Part D that's baked inside that plan. Okay, so because it's a D-SNP, remember that Medicaid, once a member is on Medicare, Medicaid no longer covers medicines. They no longer cover prescriptions. That goes to Medicare. And because it's a Part D program, it must be filed with LIS, okay, not Medicaid. So the premium that you're seeing on the D-SNP program has nothing to do with Medicaid. It only has to do with low-income subsidy and that program there. Because as you may remember, when they file these plans, the prescription drug programs do have premiums. So based on a person's LIS, that is where that LIS premium goes away. Okay? So if they have full LIS, then obviously they will not pay a premium. Okay? And we're going to deep dive into the difference of Medicaid and LIS on another call. But for now, just know that that premium is on the plan because of the prescription drugs via LIS, not Medicaid. It is not a Medicaid premium, and it has nothing to do with what level of Medicaid they have. It has everything to do with what level of LIS they have. And some folks do have a level 4, which has a 25% premium, and they will have to pay some of that premium. So it is possible that your members do pay that. It's all based on their LIS. But it is assumed that if they have full Medicaid, they will not have a LIS premium. They'll have 100% of LIS. So we'll talk more about that on another call, but just wanted to bring that to your attention. Talking to a couple of our agents out there, you know, getting some feedback, and we had an agent that received a call from one of their devoted enrollments, and the situation is that the member lived right on a county line, and the application reflected, a different county based on their zip code. So, and that happens a lot. You're right on the edge of maybe Polk County or Osceola County or Lake County and Orange County, and the member says, yeah, I'm in Orange County, but they don't know they're actually in Lake County. You never know. Sometimes that happens. So the application reflected different information. Devoted called the agent and told the agent, look, we're letting you know there was, an issue with the application. We corrected the application, but we're just calling to let you know there's no further action. There's nothing you need to do. We just wanted to keep you in the loop. And I thought that was fantastic. There's not any other company that I've heard of that is doing things like that. Just calling the agent, letting them know that there was something up with the app. They fixed the app. They educated what was the issue and how they corrected it, and then took care of it. But that communication was so impressive from Devoted that we should really consider that when you're doing business with these carriers, and how easy it is that they're making it for you. So just wanted to share that tidbit of information. Also on Friday night, had the great opportunity to talk to another agent, and I'm not going to steal his thunder too much, but Kelly Harrington had a fantastic little strategy that he does to close his sales when he does a new enrollment, and I just wanted to share what he shared with me a little bit. And the first thing he does after he thanks them for the enrollment is he says, you know what, I want you to keep me in your phone. And I can't remember if he actually plugs himself into their phone or if they plug him into their phone, but he makes it a point to say, save my information in your phone. And think of me for anything that you need for your health plan. He doesn't want them to call customer service. He tells them you shouldn't call anyone and no one should call you, and it should just be you and me in this road together. And I thought that was awesome. So as a closing strategy for your members when you're closing those deals out there, encourage them, or physically, say, hey, would you mind if I plug my information in your phone? Or you can text them your information if you've got a contact card, which most of you should know how to do that. You can text them that information and make sure that they save your information. Don't just drop that card and say, call me, because they'll lose that card. It happens. I lose cards all the time. But plug me into your phone and think of me, and no one else should be calling you, and you don't have to call anybody else. You call me and I'll be glad to help you with anything and everything. And that really creates retention with your members, trust, loyalty, and it also makes it easier for your customers' experience, right? They don't have to, call customer service or call this line over here. And that's how sometimes people get jumped off the plan, is because they call the wrong person, or they think that, somebody's calling them, United's calling them, which shouldn't be the case, right? Unless it's a case manager or something like that. But he makes it a point to say, hey, I'm the one that's guiding you here. I'm your trailblazer. Just let me know what you need, and I'm here to help. So customer service, customer service, customer service. I'm loving what I'm seeing out there and hearing, because this is really how you build a business and make it successful. So with that, I'm going to get off my soapbox and open it up. Does anyone have?
Hey, Justin. If any of our members have called Joe Namath because they saw him on TV
yeah.
and inadvertently switched plans and they're not aware of stuff, when we send out our holiday cards or whatever, can we put a note about OEP in there? And because they're our members, and what's the best way to do that? Thanks.
Yeah, no, that's a great point and a great question. In case you're not familiar with what Bruce is talking about, There is a Medicare commercial running with Joe Namath, and so we call it the Joe Namath commercial, so that's why I was laughing, because it seems to be coming up more and more. It is, just so you know, that is a third-party lead generation service for Medicare, and those folks, when somebody calls into that phone number to Joe Namath, they're going to get a licensed insurance agent, and they may be changed. So that's what Bruce was referring to on that first part. So the second part of it is yeah, sometimes they change and we don't know, right? So no harm, no foul. If you're sending marketing materials to your members, absolutely, you can send holiday cards. The messaging for OEP, we cannot mention that they have the ability to change plans, okay? So you can't specifically say, hey, call me if you want to make one more change. That's a no-no. We can't do that. But what you can do is say, hey, I'm out here. I help people with Medicare. I help people with ACA. If you or someone you know needs help with their health insurance, you can call me. Okay, but we can't specifically say, hey, you've got one more chance, so call me and I can make your change. We can't be that specific. We can't let them know that they have another open enrollment. But you can generally mention that you're still out here, you help people with the products that you help, and you're available. So, yeah, great question, Bruce. Thank you. All right, any other questions this morning?
No.
Okay, I do want to share Nick's contact information with everyone on the call. So Nick, again, is our Director of Provider Relations, and his email is nstreet, that's N-S-T-R-E-E-T, at askhpm.com, just like our handle here. So Nick Street, nstreet at askhpm.com. And his phone number is area code 304-549-4762. Okay, so that's available. If you didn't grab that, don't worry. You can call our office. You guys know how to reach us, and we'll connect you with Nick. Again, take it easy on him this week. He's still going to be brainwashed, trained this week on our HPM ways.
Absolutely.
And so, yeah, and so we're gonna do some surveys, but we'd love to hear your feedback on where you think you might need help with the physicians and how we can help you with that, and how Nick can help you in the future.
And I put my contact information in the chat box there, if everybody can, if it's easier to see it there.
Yep. Yeah, I've got it. Absolutely, got it here. Thank you, Nick. Awesome. Okay, guys, any other questions this morning? All right. Well, thank you very much. I hope you guys have a fantastic last day of AEP. Go get them. And again, we do record these calls on YouTube, so if you have, if you're not able to make one of these calls, don't worry. You can jump on YouTube and you can watch back on what we've got going on. So thank you, and have a fantastic day.